Hello everyone, this is Dr. Ayushi and today we are here and welcome to the Social Doctor, a platform where we discuss experiences, journeys and life of experienced medical professionals who are here to discuss how they achieved what they have achieved right now. And today we have a very special guest, Dr. Siddharth Shekhar Mishra, a very well-known PSM teacher who has been with DAM since the last 6 years. He's here to discuss his journey, his learnings, his points that he shares with his students every day, now and then. And he's here to discuss some very important points that every student should keep in mind while going for counseling of Neet PG. Some things, some confusions that every student is going through. If you have any doubts, do let us know in the comments below. We will share all those questions with him and definitely let you know the answers of the same. Welcome, Doctor, to the platform. It's really nice to have you here.
Good evening, ma'am, and thank you. Thank you for this excellent opportunity. And yes, the kind of word which you introduced me was experienced doctor. Now, I'll just like to correct that. I experienced student, because for the last 6 years, I have been a student myself, where I have tried to learn the queries and the skills what my colleague students, when they were in a journey. So I would probably like that you should say an experienced student discussing the queries as of now, rather than an experienced doctor.
I will love to, I believe anyways, every doctor is a student always, they have to learn and they have to grow always. So I correctly said, sir. So now, sir, when starting off with the whole discussion, firstly, we'll love to know your journey in a brief. How did you get into, community medicine? How wide, what interested you into that, and how did it go forward? How did you get into teaching? A bit around that.
Ma'am, actually, I'm an MBBS from Government Medical College in Orissa. We have 3 government medical colleges in Orissa at that time. So I finished my MBBS in the year 2012. After that, I had just finished my internship. My internship was almost over like April 2nd or 3rd at that time, due to which we were not eligible to give the NEET exam, because that time the cutoff used to be on 31st of March. So for some reasons, there was a delay. And once there was a delay, actually what happened is that time DAMS had actually opened up for the first time in Orissa. So it was April 11th when I had my first class. So I had just gone to the class just to see how things work over there. So now when I went there, there was a young guy who came to the stage. He was wearing a t-shirt and a sport shoes. So I saw that this young guy, I have never seen this guy in Orissa, because this guy is actually looks different, but he is quite young. So suddenly he stood on the stage, and when he stood on the stage, I realized he's my teacher. So couple of hours, I was good in pharma actually, because one of my teachers in the medical school, Dr. Abhinav Panda sir, when I should mention him, because he was one of the major persons who actually relatively counseled all of us that PG is important. So I was good in pharma. So I thought, ki, chalo, kuch to batayenge, which I must be knowing. So in couple of hours, I realized that I don't know anything. So the journey started like that. So then the class ended, and I came to know sir, and he was ranked 14 AIMS actually at his time, and he had only 2 choices, either radiology or pharmacology. So he didn't get radio, so he took pharma. So, but he had a very good appeasing story to tell us. So that is how my journey started. Now down the line, we had a couple of more teachers, excellent and superb. Definitely they were, and the May exam of AIMS came. I gave the AIMS exam. And then after the AIMS exam, I came back, because that time the AIMS exam used to be in Calcutta. So we had to go to Calcutta. So for my region actually. So I went to Calcutta, gave the exam, and I was like, no chance, nahi hoga. Tera to chill hoke dete hain. So I gave the exam. After the exam, I came back again prepared. Then there was a PGI exam. So I came to Delhi, I went to Chandigarh. And from Chandigarh, actually, we friends were traveling to Mussoorie. So when the AIMS results came, and that time, ma'am, we didn't have the system of like mobile pe bata de, WhatsApp aise nahi hota tha. So one of my friends from AIMS sent the photo, and I had qualified. My rank was 204. Wow. So I took up AIMS Softha initially, but because I was colorblind, I was pushed out for some reasons, because I was not medically fit. So I had to take PSM. So initially I was not happy with PSM for like 3-4 months. I was not happy, but then it was good. I started realizing that, okay, probably this is a branch I was made. In AIMS, it was a very good journey. We had excellent undergraduate students. The teachers were very good. The residents were good. And the most interesting thing was I was posted in Haryana. So I am from Orissa. So going to Haryana was initially a very big shocker because the people had got a different taste, the way they talk, but it was a good journey. So this way, 3 years got over. And I had a good journey at AIMS. After that, actually, ma'am, in AIMS, I started teaching my undergrads. So that time I felt that कि नहीं पढ़ा सकते हैं, मतलब ऐसा कोई issue नहीं है. So since I was a student at DAMS and I was connected, so I just went and I approached that, can I get a chance? So I got a chance, and then the journey started. And ma'am, the journey started way back in 2015 when I finished my post graduation. And after that, it's almost 6 years. I have been a part of this journey, but more than that, I've been a part of journey with the students. So currently, if you ask me, I'm more connected with the students on a personal level because I have lived my journey with them every moment. So that is probably I should now stop with my journey. And yes, I have some 3.5 lakhs journeys to share probably because these are the number of students I got an opportunity to train in this period of 6 years at DAMS. So probably I can say I have a journey of so many young and dynamic people who few succeeded, many failed because our system is like that. But probably all of them were champions and warriors who have actually taught me a lot, which brings me to a forum over here talking to you and sharing those experiences. That's all probably from my side.
Definitely. So, I completely agree. The system is too competitive. Otherwise, I agree. People who are sitting for Neet PG, all of them are, it's difficult. To prepare in itself is a big thing. I completely agree with this. So now, sir, after the Neet PG results are out, there are different issues also going on. But after that, the biggest thing is to pick up a branch. What to pick up, how to pick up, in what. So there are a lot of things that should be followed before picking up a branch. Also with rank is definitely one thing, but then there are some things that goes with your personality, your trait, what you are looking forward in your life as some pointers. So what will you suggest, how people should go forward with that?
Ma'am, I'll first start with the don'ts. The first don't is never choose a branch looking into how much money you will get. Ma'am, because it is a reality that at the end of the cycle, almost, which is a cycle of a decade probably, all the clinical branches, I'm not talking about non-clinical and paraclinical branches, all the clinical branches almost earn the same amount of money. So that is the first don't I will request all of you, don't look into money to select a branch. Now, what should you look? The very first thing I would tell any candidate is match your personality. I'll give you some examples. Ma'am, basically, every person has got only two personality traits. One, who is a risk taker and an aggressor. One, who is a person who is very studious, takes a slightly bit less risk, but is a stable person, is more of a stable person. The person who is a risk taker should always think or imagine himself to be in the surgical side. A person who can study a lot and who is a persister should be in the medicinal side. Because, ma'am, in the surgical side, there is a lot of daring attitude which is needed. We typically see a meme these days on Facebook where a hemoglobin 7 report has come and the person is actually tearing it and Shah Rukh Khan, like in Dar, is eating the report. सात hemoglobin है, कोई problem नहीं. कल OT पे तो ortho या surgeon operate करेगा ही करेगा. So a surgeon or an orthopedician or an obstetrician is like that. So if I have to choose and I'm getting all the option, I would first ask, am I that person who can dare? Who has the risk-taking capacity? Because, ma'am, it's a reality when you open up the abdomen, okay? The way we read anatomy, the reality is not that. The abdomen looks totally different. And I can tell you this because I come from a family where my elder brother and uncles, they are surgeons. And that's the reason I never wanted to do surgery initially, because you understand the peer pressure you have.
Yes.
And I used to go with them to the OT to just see. So actually when they used to, when I open the abdomen, I used to say, hey, ऐसे तो कभी देखा ही नहीं है कैडावर में. कैडावर तो अलग दिखता है थोड़ा सा. तो they said, हाँ ये live है ना, तो difference तो होगा ही. But and when it used to bleed, it used to like spray out. So they used to like calm, no problem, just put pressure and it's all done. So if you are a person who is nervous, who is anxious, I'll say don't take surgery. Now coming to the medicinal branch, you love to study, you are a stable person, you know कि आपके जिंदगी में किताबों के सिवा आपका ना कोई गर्लफ्रेंड है, ना बॉयफ्रेंड है, ना दोस्त है. So you should take medicine. You love studying. book ke baad book, you will keep on studying. So I feel this is the first thing you should match with personality traits. Second, health profile. Ma'am, because personally I had faced a health profile issue due to which I left ophthalmology. A health profile, ma'am, suppose I have got a back problem. I should avoid orthopedics. I should avoid surgery. They are long surgical branches.
Correct.
Because if I do a surgery and I plan to do an onco surgery or this cardio surgery or neurosurgery, they are long surgery. So I should avoid if I am having some orthopedic issues or back problems, something like this. Now, similarly, if I have migraine, I should try to avoid obstetrics, because obstetrics is one branch where the patient can come up anytime. You cannot just say, nahin, raat hua hai, abhi nahi, kal subah dekhenge. You can't do that.
Definitely.
Similarly, if I am having some kind of history of anxiety or stress in the past, so I should avoid branches which actually give me stress. Like obstetrics is an absolute stress. Pediatrics, if you are a neonatologist, that friction of a second or a friction of a minute, the child can land up from being a normal child to a cerebral palsy child. So in that case, I would say that खुद को पहचानो, अपने trait को समझो कि क्या तुम ये risk ले सकते हो? Can you actually take this risk? Or can you actually take that stress? If no, stay away. There's nothing bad in it. So this is the couple of things which I would say that you should decide. Now let us come to the sub-stratification. Now I understand I want to take surgery. Now generally students say that orthopedics is a terminal branch, so I'm getting orthopedics, so I should take it. Surgery is not a terminal branch, so if I take surgery, I should do an MCH. Now trust me, the way our country is going ahead in medical curriculum, orthopedics one day will also become not a terminal branch, and you need to do a lot of fellowships.
Correct.
So please don't differentiate orthopedics and surgery just looking into these things. Second, please do not rate orthopedicians as Kabir Singh. Okay, that is just quite a different myth which people have developed. That's wrong. Now, the basic difference, what I feel, difference between an orthopedician and a surgeon is probably a surgeon is one who is also looking into that. Okay, I want to do an onco surgery. I want to do a neurosurgery. Suppose I'm thinking like that, surgery low. There's no problem. If I don't want to do all this super specialty, take orthopedics, you will have a good time, because the number of patients which probably an orthopedician sees and a surgeon sees is same. There would not be hardly too much of difference. And with the way India is going with the aging population, orthopedics will have more patients, and it's a reality. So that is how I will differentiate. Now coming to obstetrics. Obstetrics is a very good branch if you are a girl. If you're a guy, in the eastern part of our country and in the western part of country, and to some extent even in the south, there are more male obstetricians than female obstetricians. In the north, they do not prefer a male obstetrician. So if you ask obstetrics, I'll say ladka ladki both are equally respected, but again it depends upon the area. So again, obstetrics, people say it's just a terminal branch. Now mind it, obstetrics is a challenge if you ask me, because I always tell my students it is actually not one subject, it is two. One is a O, one is a G. So technically one day they will split up. Obstetricians will be different, gynecologists will be different, because two are different branches. Obstetrician, chronic emergencies.
Correct.
Gynec, minimal emergencies to some extent. That is what I have witnessed in these 6 years. My students who have done obstetrics, they always tell me this. There's an obs हमेशा emergency है, कब क्या होगा कोई पता नहीं है. Gynae, आप पेशेंट को कल भी बोलो हिस्टेक्टोमी करना है तो ठीक है, कल सुबह आ जाएगा. So you need to make that call. Now, when students make this choice, there are many students who say, "Zindagi bhar stress रहेगा." It is not like that. Once you finish up with your residency, the residency means a junior and senior both. There is 3 years of a postgrad and 3 years post that, almost 6 years. Once you're done with the postgrad, after that you can make a choice that do you want to lead an emergency life or not. You might not take obstetric cases. You might not do emergency surgeries. You can choose that. So ऐसा नहीं है कि सिर्फ उसमें chronic emergencies है. So that is how I will rate these subjects. Now there are two subjects more in surgical branch. One is ophtha and ENT. Ophtha is a beautiful subject. You don't want too much of ruckus. You are a smiling gentleman or a gentle lady. You are able to do fine surgeries. Now that is one skill, because ma'am, I have witnessed people having fine tremors. If you are having fine tremors, please don't take ophtha, because it's a microsurgery. Now comparing ophtha with ENT, no bias or no, I will always say ophtha is better, because to one extent is because as per our health system, an ophthalmologist gets a job at a CHC. There is a post of ophthalmologist at a CHC. ENT does not have, due to which the funneling effect happens. ENT में jobs कम हो जाते हैं. Otherwise ENT भी एक अच्छा subject है. ऐसा नहीं है कि ENT बुरा है, but ENT में थोड़ा सा job issues हो जाते हैं. So if I'm getting both ophtha and ENT, I would personally pick up ophtha because थोड़ा job opportunities ज़्यादा है. So this is how I will rate the surgical branches, and I'm not going into the 6-year subjects because वो बहुत rare है, and people probably who are doing those subjects are better to answer. Now, if you look into the medicinal side, medicine and pediatrics, I love kids, I take pediatrics. I hate kids, I never take pediatrics. Because I have seen myself in my family, you take pediatrics, you can never sleep in the night. Because the baby will cry in a night, and as a human being, you cannot sleep. Medicine, I'm ready to do a DM, I should take medicine. This is a wrong concept. Because now, ma'am, even pediatricians are doing DM. And pediatricians are allowed to do DM in adult branches. So they can do nephrology, they can do oncology, they can do cardiology. So ऐसा नहीं है कि मैंने pediatrics लिया तो मुझे बस neonatology DM है. You have opportunities. So then again, choosing between medicine and pediatrics, the choice is only this. Do you love a child? Can you handle a child for 1 hour of king, that crying? Because the child will be in pain.
Yes.
So that is where I should understand. And if I am having a good personality, a smiling personality, I'll say pediatrics is an excellent branch because you will have the maximum satisfaction in pediatrics because the moment the child smiles, you forget your stress. It's a reality. Now, above that, 2 branches, radio and skin. Now, there's a very common myth people say, it is saturated. We live in India, trust me. Even if you have every year 10,000 radiologists, you would not be saturated. It is saturated in Delhi, it is saturated in Mumbai. Let us just go to places near Delhi, probably to Sirsa, to Manesar. We don't have radiologists. People come down to actually do that. Now, generally the top rankers have got a choice of medicine, radio and skin. So if someone is taking medicine, that's fine. If someone is going to take radio or skin, I'll say the way you choose it, if you want to see few patients, take skin. If you want to stay without patients, no interaction, you want to have your call, that नहीं, मैं तो घर पे बैठ के Zoom पे मैं report share करूँ, मैं Zoom पे देखूंगा, मैं London से देखूंगा. Take radio, no problem. And trust me, there is nothing called as a patient satisfaction. In radio and skin, you will have an ample satisfaction because you would get chance. So there's nothing wrong in it. So let us not undermine their importance by saying कि इज्जत नहीं मिलती है. The world has become like that. अब इज्जत मिलती नहीं है generally. We cannot say in the metros. You go to a rural setup, you'll get that respect. So let's not have that wrong way to rule out those subjects. Now coming to the lower side spectrum, 2 medicinal branches, psychiatry and anesthesia. Anesthesia, if you ask me, is generally that person who got slightly a lower rank, wanted to be a surgeon, wanted to be an obstetrics, so whole life keeps on staring at the obstetrician and the surgeon or the orthopedician. थोड़ा और पढ़ लेता ना तो मैं आज वो सर्जरी कर रहा होता. ठीक है? But it's not like that. Anesthesists have their own role. Critical care, they are the people who handle the ICUs. उनके बिना ICUs नहीं चल सकता है. See, trust me, no medicine specialist, no surgeon actually knows to intubate properly or put a central line. Anesthetists are experts. So they are the people who actually save us at the end of the day. So let's be appreciative to the branch as well. So and there's nothing wrong to say that I cannot have an independent practice. Fine, there's nothing wrong. Even a radiologist generally cannot have an independent practice unless until the person puts in to buy a CT or MRI machine costing worth of crores.
Correct.
Psychiatry, if you ask me, it should be taken only by a person who is very strong mental stability. If I am having any mental health issues, I should not take psychiatry because I will associate myself with the patient. तो ना वो फिर दिल का जब कनेक्शन होता है ना, I start feeling मुझ में psychiatry कमियां है, patient में नहीं है शायद. So anyone who takes psychiatry, please take psychiatry if you are a very, very strong-headed person. Because ना बहुत दिल पे चुभती है. Because the way people will come and complain to you, ना, you would actually feel what the hell is this? ऐसे कैसे लोग सोचते हैं? But it's normal. It's normal. So psychiatry also you can have a choice. You don't want to have a tough life like anesthetist. You don't want to answer anesthetist. Take psychiatry. You will have a good time. So this is how probably, ma'am, I would range as per my discussion with my students, because I am not a clinical person, so I would not say the in-depth analysis, but this is what my students across the years have told me, and I've experienced it also, that this is how you should make choices of the branch.
No, correctly said. And actually this is a very important thing to analyze, ki how to go for a branch according to your personality and not to go towards the misconceptions about different branches that everybody has. And as you covered already, you know, there are some myths around the end branches, the terminal branches, and the branches that are super saturated, and correctly said that this is just, you know, this is not going to last forever. So now sir, एक और है, people, there are times कि जब आपकी रैंक आती है तो you are like, या तो आपको अपने पसंद का ब्रांच मिल रही है and you're going for that dream, or you are going for that dream college of yours. There are two things, you know, you need to sometimes decide कि आपको कई बार मौलाना में आपको बहुत अच्छी ब्रांच मिल रही है, लेकिन जो आपको ब्रांच चाहिए वो आपको जाके किसी छोटी सी जगह पे मिल रही है जो शायद आप नहीं जाना चाहते हो. तो what do you think a person should do? Should the person go for the branch or for your dream college?
Ma'am, one of my consultant at AIMS had used a very beautiful statement to explain this. He said, the college is your girlfriend who stays with you only for 3 years. The branch is your wife who will stay with you for your lifetime. So always choose the branch rather than the college, because branch stays for the lifetime. Simple. Suppose there is a person who is an MD anatomy from AIMS. He or she is from AIMS. Suppose I have got an abdominal pain and I suspect I'm having appendicitis. I would not hesitate once also to go to a surgeon. And I would never even see from which college he is a surgeon, because I know he's the only person who can operate me and save me. But I will never go to an anatomy person because I know his specialty is something else.
Correct.
So 100% time choose branch above college. There is no question about it. Please always choose your branch.
So sir, now after explaining this, there is आपने थोड़ा तो cover कर दिया anesthesia का dilemma, but still there are, I have got some multiple questions regarding anesthesia that sure, people are always like, should take anesthesia or not? If take anesthesia, you know, या drop out कर लें, फिर से, you know, next Neet PG दे दें. But then there is one more question कि Neet PG ये दे देंगे और मान लो इसमें अच्छा नहीं आया तो the next maybe through the procedure is also changing, everything is changing, how will this end up? And there is lot of confusion, and actually Neet PG is very close now, the next also. So how to figure that part out? What is your suggestion for students of those kinds? What should they do?
Ma'am, to be very true, do not compromise on your branch. Never ever. अगर मुझे anesthesia मेरी choice नहीं है, I should never take anesthesia, or for that cause not even psychiatry. And I'll quote over here one of my interns in AIMS. He had got rank 3 in AIMS. And he only wanted neurosurgery. Neurosurgery में सिर्फ एक सीट था. Rank 2 ने neurosurgery ले लिया. He left. उसने अगले बार AIMS दिया. उसने बोला मुझे neurosurgery ही चाहिए. Now the reason to it is because if you compromise with the branch, you stay with the branch for the lifetime, and you are not going to be happy with it. So basically, what I was mentioning is, ma'am, you should not compromise with the branch. It is not only about anesthesia. If you do not want a branch, like suppose I am hell bent to get radiology, and I'm not getting radiology, and I'm getting medicine, I should not take it up, because it is like marrying a girl whom you don't like or love. So it's वो गलत है. So basically, I'll say repeat again, prepare again. There's nothing wrong. See, and we always say there is no time frame for your dreams. See, we know the president of US at 48, Obama retired. At 68, Donald Trump retired. Biden has become a president probably 77 or 78. So basically, you don't have the time limit for your dreams. So there's nothing wrong in it. So do not compromise on your branches. And especially it's a very common compromise. People say मुझे surgery चाहिए. It's fine, I'm not getting surgery. मैं AIMS में pharma ले लेता हूँ. Pharma करते करते मैं surgery के लिए prepare करूँगा. You cannot do it. You cannot stand at the same time on 2 boats. So it's always advisable. No problem. Let's give a year more and actually give more time.
बिल्कुल.
So that is where I feel that we should not actually compromise on it.
बिल्कुल sir, बिल्कुल, you know, this is something very correctly said. One more thing, with the same thing, there are some students who are getting non-clinical branches.
Yes, ma'am.
Or when you're preparing for Neet PG, you never aim, very less people aim to get there, but maximum people aim to get a clinical branch and to pursue that and have those dreams. So anything for them, you know, what are the opportunities attached to that? If, you know, if they are picking up that branch, or if they are confused, what should they do?
See, the problem is a social desirability bias.
Correct.
In India, basically, the non-clinical and paraclinical doctors are not considered as doctors because of the typical social vision that a doctor is one who puts up the stethoscope. And that is the reason in India, non-clinicals and paraclinicals do not generally have a good run.
Definitely.
But again, let us understand that the core research or the basic sciences, that is the anat, physio, biochem, they are the start of every story. You start your MBBS, you start your BDS, you start with these three basic subjects. So imagine, I as an individual am very clear that I want to be a core teacher, a core scientist. So I take up these branches. But again, I should prefer to take up these branches in the central institutes, because peripheral state colleges do not have that facility actually to provide you that kind of launching pad where you do it. So if and unless you do not have the mindset to take these branches, please again do not compromise and take it, because there must be someone more needy. I'll cite a personal example. One of my batchmates, she read Robbins, and after that she said, I want to be a pathologist for my life. And we said, मजाक करिए अभी आगे बढ़ते हैं तब देखेंगे. And trust me, she was getting the clinical branches, पर भी उसने pathology लिया.
अच्छा.
That नहीं, मुझे तो pathology से ही प्यार था, and मैं pathology ही लूंगी. There is nothing wrong in it. Similarly, another of my colleagues, she took up microbiology because her better half had a pathology setup.
Achha.
So she took up microbiology because they can complement each other. So there is nothing wrong in it. So we should not. Suppose you ask me, sir, would you have taken pathology? I would say, no. I would not have ever taken. But imagine, I would have taken pathology to block a seat, but the person next to me would have preferred to take pathology because for some reason, that person's seats I have destroyed. So it is not advisable. And that is the reason, ma'am, if you see these days, the penalty of leaving a seat has become very high. The government has started taking huge penalties if you drop a seat. Because the government also understands that there must be a needy student who might be interested to take up this branch, but he or she does not get. Forensic. Ma'am, there are some people who are very much interested into investigations. They take up forensic. There's nothing wrong. But imagine, I don't want to do a postmortem. I don't want to go to the court. I should not take it.
बिल्कुल.
So ये mindset, मतलब it's a take home message सबके लिए. Branch पसंद नहीं है, compromise मत करो. You don't compromise with your branch, please. It's as simple as that. See, I want to have a pizza. I will have a pizza at Domino's. I cannot compromise it and have it roadside. Stating यार pizza तो pizza होता है, ऐसा नहीं होता है. The brand Domino's has something to extra to offer. So kind request to all the students who are hearing this. I know it's a tough time. कई बार हमें लगता है कि 3 साल हो गया, 4 साल हो गया. ठीक है यार. There's no limit to your dreams. You're already a doctor. Come on. You're the person who is the cream of the society. Highest respected person हो तुम. ठीक है. So don't feel insecure. Fine, a year more, 6 months more. There's nothing bad, if you ask me personally, to prepare.
That's very motivating, sir. So with this, we have also one doubt of people not getting a favorable branch for their masters and going for DNBs. So there were multiple questions that DNB ke liye jana chahiye, nahi jana chahiye. There is one myth in the society ki, DNB people are not as valued as masters, MS, MD. So what is your suggestion for them? Should they pick up DNB or not?
Okay. So to answer this question, personally, I applied for a PhD at University of Auckland. Because I'm MD from AIMS, I was very happy to write it. I got a reply. We're extremely sorry, your degree is not recognized over here. I was like, what the hell is this? You are not recognizing an MD AIMS degree in New Zealand. Aisa kya hai? I finished my MD. There's a provision. If you finish your MD, you can also write the DNB exam. I wrote my DNB exam and then I applied. They accepted my application because DNB is recognized outside country. Achha. So there is nothing bad in doing a DNB. That's the first thing. Second, some branches like ophthalmology, if you remove some 5 to 6 institutes in the country, DNB in ophthalmology in centers like LV Prasad, Shankar Nethralaya, Arvind Eye hospitals, they are excellent. They're superb. 6 years courses of DNB, neurosurgery, superb in Gangaram. You would not get those hands-on ever anywhere. बिल्कुल. तो अगर मुझे गवर्नमेंट में नहीं जाना है ना, बिकॉज मैम इट्स अ रियलिटी कि अभी भी देयर इज अ बायस, डीएनबी कैंडिडेट्स को गवर्नमेंट में जनरली प्रेफर नहीं करते हैं. सो अगर मुझे गवर्नमेंट में नहीं जाना है, आई लव अ स्ट्रीम और अ ब्रांच, डीएनबी इज नेवर बैड, बट The only rider is choose in a setup which is reputed, because pass percentage becomes an issue. My DNB exam was conducted in MGMS Wardha. So I had given a written exam, and my Viva and practical was in MGMS Wardha. So the challenge I had in Wardha was, because I'm being a community medicine person, we had to go to the community. People were speaking Marathi. मुझे तो नहीं आती है ना मराठी, मैं कैसे वो मैनेज करूंगा? But luckily क्या था कि जो examiners थे, they were understanding कि the language is a barrier. But when they were asking me questions, I was able to answer because I had read that in my MD curriculum. They asked me some programs related जो महाराष्ट्र में specific है. I had no idea because मुझे महाराष्ट्र का health system ही पता नहीं है. मैंने दिल्ली में पढ़ा है कि हरियाणा का आप पूछोगे मैं बता दूंगा, पंजाब का पूछोगे मैं बता दूंगा, but I had no idea. So those were some small things what I personally faced when I was giving a viva or a practical for DNB exam. So same rule appears when a clinician gives. Imagine there's a pediatrician and the pediatrics guy is from Delhi and has got the pediatric center at suppose Chennai. Pediatrics में उस बच्चे की माँ तमिल ही बोलेगी बेचारी. We cannot expect that she will be fluent in English or speaking Hindi because the language is Tamil. So imagine the guy might or the girl might be excellent, but might not be able to communicate.
Yes.
And many times what happens is, it's a reality. In the PG, many times we are not that well prepared theoretically because there is a lot of duty pressure. So sometimes when the examiner asks us question, it's our internal examiner who actually supports us. That nahi sir, the candidate acha, aap isse ye pucho. That happens. In DNB, you don't have home advantage. See, it is typically like India conducting the T20 World Cup, but it was conducted in the Middle East, and India lost in the very first round because there was no home advantage to India. The same rule applies in DNB. So, ऐसा नहीं है कि आप DNB नहीं कर सकते. But you should be careful in choosing the institutes, and you should understand that government में you will be always given the least priority. Let's say least. Because that there is a kind of bias, but probably see, I guess a decade more where this bias will also go when DNB people will be in good positions, because now even the DNB people have been started being recruited in AIMS, PGI, places like this. So probably जैसे जैसे उनकी number बढ़ेगी ये bias कम होगा when people actually realize नहीं he or she is a very good candidate, उसको आता है ये चीज. So probably time लगेगा, but there's nothing bad in choosing a DNB if you are getting it a good setup.
Bilkul. So actually we had a same question from one of our viewer that to prefer MS of some specialty or DNB of specialty of choice. And if I choose different branch, what's the amount of regret that stays with my life? So something you have mentioned, but still if you can, just answer him.
These are two different questions. Now, coming to MS and DNB ka choice, it all depends upon the institute. Now, imagine I'm getting a DNB at Gangaram. And I'm getting a MS at a very peripheral college, very, very peripheral college. I will prefer DNB in Gangaram. My exposure better hai. Because I see myself to be working in a corporate. I am not wanting to work in the rural setup.
Correct.
But imagine मुझे एक rural setup पे काम करना है, so I'll prefer an MS because गांव में पर भी आजकल लोगों को पता है MS और MD क्या होता है. वैसे गांव में अभी भी आप plain MBBS हो जाए बहुत बड़ी चीज हो जाती है. So but if you want to a surgical specialty, हाँ तब उस case में MS. So you need to set the priorities right for your life. What priority are you looking for yourself in the life? That is one. Second, regarding regret of branch, see, trust me, if you ask me, now when I go to my alumni meets where my friends are oncosurgeons, my friends are cardiosurgeons, if you ask me if I would have been just a PSM guy, I would have felt very, very much inferior. It's only because of my students. I never feel that because they are my assets. I can claim that I have more contacts in the obstetric fraternity than my friend who's an obstetrician, probably. But it's because of my students. So guilt phenomenon na, wo bahut din rehta hai. And that is the main reason you must have seen the anatomy teacher is the most strictest, and we typically say saddest, सबसे ज़्यादा saddest anatomy वाले थे, because they generate that frustration inside. Okay, so that's why I always feel let's make a smiling face. Let us make each other smile rather than punishing each other because I did not do well. Why should I punish my junior? Correct. So better not to compromise. Regrets बहुत ज़्यादा होता है, बहुत ज़्यादा feel होता है, and that is the reason dropouts बहुत हो जाते हैं. If you see the dropout rates of non-clinical, paraclinical, it is almost 50 to 75%. अच्छा. इतना ज़्यादा dropout अगर होगा, मैंने across country, मैंने I'm not mentioning like for a college, AIMS में हो सकता है dropout कम होगा, peripheral में ज़्यादा होता है, but across यही है So इतना ड्रॉप आउट में फिर मैंने it's not advisable. ऐसा नहीं है कि सर्जरी से ड्रॉप आउट नहीं होता है, लेकिन सर्जरी में 10% ड्रॉप आउट होगा when the candidate thinks that I'm a misfit. मेडिसिन से 10% होगा, ऑब्स्टेटिक्स से 10% होगा, पर नॉन क्लिनिकल पैराक्लिनिकल में बहुत ड्रॉप आउट्स होता है. एंड इसीलिए आई से डोंट वेस्ट अ सीट. शायद मेरे पीछे वाला कोई है, उसको बहुत जरूरत है, हो सकता है उसके कुछ पर्सनल इश्यूज है, ठीक है, घर पे पेरेंट्स बहुत ज्यादा उस पर डिपेंडेंट है, दैट पर्सन माइट नीड इट. So let us step aside, tell my dream can wait for a year more, and I stand in the queue again. There's nothing wrong in it.
Yes, yes. So correctly said, sir, and very correctly put, you have put all the points in. So apart from all of these were some of the points in my mind that I wanted to discuss, and some of the questions that have come from the audience. But if some of the points are still in your mind that you think are very important for the students, if you can, let us know, that will be great for students who are waiting to sit in the counseling.
I would say the best way to select a branch is go do a duty for 7 days. You might not do the active duty. Stay there and see what the residents are doing. You would understand what actually you will do, because to say that obstetrics karna hai and actual obstetrics mein bahut antar hai. Because generally in obstetrics we are given a pelvis and bachcha hai ye 9 steps of labor aise nikalta hai. Reality mein aisa nahi hota hai. So you need to do the duty. This is the first thing I will say. Second, talk to 5 people. 5 is an odd number. Take the majority and trust them. So do not stick to one view. Probably my view might be skewed. Talk to 5 people. Those 5 will give you the ultimate view. And if you are trying to get confused, you just tell them. Just answer, would you take surgery or ortho? They will give you one answer. So after 5 views, you see which is the maximum votes. You do that. You will never repent. Third, don't take a branch for money. Please trust me. At one moment of time, all the branches will have almost the same money. The clinical branches. I'm not talking about the non-clinical and paraclinical branches. Clinical branches, all of them at one moment have the same amount of money. But again, you should match your personality with the branch you are going to take. It will make you a better clinician or a better doctor. Non-clinical and paraclinical people, see, trust me, don't feel inferior. If you have that inner fire to be a scientist, to be a researcher, and to teach the students, take these branches. You will love it. It's probably you're made for that. So ऐसा कुछ नहीं है कि आप ले लिया तो inferior है. ऐसा नहीं है. Have your faith that yes, if you want it, please don't compromise and take it. कि मुझे चाहिए था रेडियो लेकिन नहीं मिला तो मैंने ले लिया एनेट. ऐसा नहीं. This should not be the case. ठीक है. There are excellent people like BD Chaurasia sir. If you hear his story, which I also used to hear, that sir was a medicine PG. शायद उनको कुछ किसी एक आर्टरी का पाथ पूछा तो उन्होंने समझाया. The external could not understand. He was frustrated. He left. बोला अब मैं anatomy लूंगा और लोगों को बताऊंगा anatomy ऐसी होती है. No, you can have a person like BD Chaurasia sir. There's nothing wrong. Robbins, I don't know whether that person is actually alive, the authors or editors, because trust me, the best book of the medical sciences is Robbins. You cannot match a book like Robbins. Probably Harrison is also somewhere different. Robbins is still great. So you might be the next person who is writing Robbins. You never know. So have faith on yourself, but choose a branch which आपका दिल से बोले कि नहीं यार ये लेना है. पैसा वैसा नहीं, match your personality और उस हिसाब से आप लो, you will be happy. See, at the end, the goal is to stay happy.
Correct.
Whatever you do, so do that. That's all probably I would like to share.
Yes. This is very motivating and very correctly put into words, sir. So now lastly, sir, wanted to ask something from your life, something that keeps you motivated to go and to educate and to motivate so many students out there, something that you do to motivate yourself. Any motivational word or something as a practice you do?
Ma'am, to be very true, at the end of the classes generally, we have few students who come up and say us a thank you. And they say that actually we change the way they now look at a subject or a branch, or we change the way they look at life.
Yes.
That is probably what motivates us. Because trust me, we do a lot of sacrifices. And it's not, we means not as a teacher I'm saying, because probably every weekend we're out teaching. Our family misses us on a weekend when the family can have a time with us. But the only thing our family understands is that we are doing it as a greater good. Some people think that probably money drives it. Trust me, when our first year जब पढ़ाते हैं ना तब तक money सोचते हैं. After that we say नहीं यार नहीं चाहिए अब. It's too much. But probably the smile a kid has at the end of the class, when we do it. And probably see, I'll tell you, see, when I go to AIMS these days, there are more number of students who greet me than they would greet my professors. So it makes my professor smile. Yeah, chala, our candidate has done something good. So probably that is what gives us an inspiration that yes, that something good we have done. We go to the airport, we go to the restaurant, people know us. So probably that is one thing, मतलब जो हमें पुश करता है शायद, एंड शायद जो टीचर्स मुझसे भी ज्यादा सीनियर है शायद वो भी ये मानते होंगे कि मतलब जब सिद्धार्थ सी आई एम ए स्टूडेंट टू people like Sumer sir, Tushar sir, I've been a student to them. So probably if they see this video, they will feel happy that ठीक है हमारा student अच्छा कर रहा है, because we don't have any competition. See, you cannot have a competition between a teacher and a student.
Definitely.
Yeah. So that those things probably pushes us to teach probably and to remove ignorance. And see, as a popular quote says, I might not be the king, but I'm the kingmaker. Okay, so I might not be a radiologist or I might not be a dermatologist, but yes, I can proudly say that I have many students who are now radiologists or dermatologists or obstetricians or medicine specialists and or surgeons or orthopedicians who are out there, even in this COVID pandemic, saving lives. So probably that is the best kick we have. And last, probably, if you ask me, we'd never ask the religion, the caste, the creed, the socioeconomic status of the patient. So that separates us from everyone. Yes. Trust me, there is nothing bad when we come back after a night duty, and while we come back, we actually see that the person whom on the night we were giving a CPR, the person is alive. इससे ज्यादा अर्निंग शायद मतलब हम एज एन इंडिविजुअल नहीं कर सकते हैं. सो दैट इज व्हाट, इफ यू आस्क मी, as a teacher, as a doctor, I have experienced, and I expect all the students who are listening to this would have experienced these small special stories. So that is the fire which should push you guys, that you are above all. You might face a lot of criticism. People might say you don't give time, you don't have time for us. Yes, trust me, yes, there are some people whom you will feel that yes, you should have given them time, your own family members. But trust me, the day you chose this profession, your family is the humanity and the world. It is not just your immediate family members. So that's all from my side, ma'am. Probably.
Wow, sir. So nicely mentioned, and so many things you have answered without asking, without, I have not put them into questions, but you have answered so many questions into this. Thank you so much, sir, for this wonderfully done session. We have some messages from Dr. Sagardeep Datta, that so beautifully put session, sir. It's just apt for the students to understand what should they consider while going forward. Please share it with your friends and colleagues. This is such a fantastically put session. It will definitely motivate all your friends, all your colleagues who are sitting for counseling, or they are sitting in future in the next Neet PG. Something that will keep them motivated, will help them understand what points to consider while picking up a branch, and what points to consider to go forward ahead and to keep yourself motivated. Thank you so much, Dr. Siddharth, for joining us today. Thank you so much, everyone, for being with us. Also, do not forget to follow our YouTube and Insta pages as well, where you can find all our old videos that can also help you with your career growth. Thank you so much, everyone, for joining. Bye-bye. Good night, everyone. Thank you, sir. Bye-bye.